or assisting a parent in helping a child with maybe more of the normal, typical fussy eating is firstly to not worry and to continue repeating exposure to a variety of foods, even though a child says no. So there is, some evidence that repeat exposure, up to 15 times of one particular food is enough to let a child decide whether they like to eat it or not. Um, and of course, like every other person, children also have preferences for foods. Some foods they like and then some foods they don't. As long as it doesn't seem to be impacting growth, or other psychosocial impacts, then eventually you hope it's something that they grow out of, and that parents, we should just really support them in not worrying about their child's fussy eating.
Yep.
And maybe not label their child as a fussy eater, because this can kind of, make a child identify with that fussy eating.
Yeah.
On the other end of the spectrum, we have a fussy eating disorder that's now in the DSM-5, so the Diagnostic Statistic Manual for Psychiatric Disorders, and that's Avoidant Restrictive Food Intake Disorder, or ARFID. And to meet this criteria, fussy eating seems to be within the history of a child developing this disorder. But we also know that this disorder is related to autism and other psychiatric conditions like obsessive compulsive disorder. So there seems to be a constellation of disorders here. Children with ARFID tend to present with a decrease in growth. So they might not be putting on enough weight, or they have growth faltering. They dip across percentiles in their growth. They might be excluding whole food groups and have nutrition deficiencies. But this might be affecting their nutrition deficiencies, might be affecting their socializing, their hobbies, their ability to learn. So these are kind of a bit more, I guess, stringent criteria, and at that very severe end of the spectrum where a child is not eating enough.